Great. Well, good morning, good afternoon, and good evening. Welcome to WADM's first webinar of 2021 titled Lend a Hand, Lend a Shoulder, COVID-19 Vaccination Operations in Israel, presented by Dr. Odetta Benin-Goren. Thank you for taking the time to join us today. My name is Sarah Vega, and I'm the program assistant for WADM. I'd like to cover a few logistics before we get started and then hand off to the presenter. First off, the webinar is being recorded and will be posted online within the next 24 hours. We'll let you know by email when the recording is available. During the webinar, feel free to submit questions through the question tab located in your GoToWebinar control panel, and then we will share them during the Q&A session. You may also click on the hand icon in the control panel to virtually raise your hand. And then we can unmute your microphone and you can ask a question directly to the presenter. Lastly, if you haven't done so already, please check out the recent pre-hospital and disaster medicine podcast series featuring discussions with authors of recent articles published in the journal. The podcasts are available on WADM's YouTube and SoundCloud pages. So without further ado, I would like to briefly introduce today's presenter. Odetta Benin-Goren is a registered nurse certified in emergency nursing. She also holds a PhD and has a broad experience as a clinical nurse in the fields of international medicine, public health, and emergency medicine. Odetta was among the pioneers that established the National Emergency Nursing course so that nurses could become certified in emergency nursing. As a CEN, she specializes in all types of emergencies, including mass casualty incidents in Israel. During the last decade, she specialized in the area of disaster humanitarian response and works with government ministries and agencies worldwide. In addition to her fieldwork, Odetta is also the academic coordinator of the Emergency Management course at Prepared, the Emergency Response Center at Ben Gurion University. Odetta is also a United Nations Disaster Assessment and Coordination member under the UN Office for Coordination of Humanitarian Affairs. She is also a consultant for the World Health Organization and the Department of International Cooperation at the Israeli Ministry of Foreign Affairs in the areas of emergency medicine, nursing, trauma, intensive care, disaster preparedness, and risk assessment. Before we start, on behalf of WADM, I'd like to thank Odetta for taking the time to share information about Israel's vaccination operations with us today. So Odetta, the floor is yours.
Thank you. Good afternoon from Israel. Thank you, Sarah and Andrew, for your introduction and your welcome. And thanks to all for joining us. The past year presented us with many challenges, personal and professionals. During the time of this webinar, we are facing different reality. And during this time, about 334 people may die from COVID-19 worldwide. And this is only during the time of our webinars. During the past years, until yesterday, the 9th of February, sorry, just a second, something don't move. Oh, okay, sorry. Until yesterday, the 9th of February, more than 106 million COVID-19 cases were confirmed worldwide, and about 2.3 million people have died. The deaths were not related only to numbers. Every one of these numbers presented people with names, faces, families, and dreams. When they died, they left behind memories, sadness, and pain. As of today, it looks like COVID-19 will stay and continue staying with us for a long time. And it will going to be part of our life. And then the toll of human life may increase unless we contain the spread of the disease. To contain the spread of the disease, we have to achieve a herd vaccination. Many countries have started to provide COVID-19 vaccinations. Israel is a small country, about 27 square kilometers, located in the Mediterranean, In a way, because of our geographic structure and our neighborhood, the country is in an isolated island, a fact that can help us to contain the pandemic. There are about 9 million citizens in Israel, of them Jewish, Muslim, Christian, and some other minority, with different cultures aspects. These differences affect the cooperation of the population in the vaccination operation. All of the Israeli citizens are covered by national health insurance through 4 health maintenance organizations that provide all medical care from primary to hospitalization, and it's well established and create an advantage when locating and reaching the population, especially concerning special groups and vulnerable population in the country. Today, the 10th of February, Israel faced a number of patients of 70,270 active patients in Israel. And we have about 1,600 and more patients that were hospitalized. Among them, 1,025 patients in serious condition, 383 are critical, 642 patients are ventilated, 34 patients are on ECMO. Since the beginning of the outbreak, more than 5,000 people have died and about 625,000 people are recovered. This is additionally to regular patients that we have in our system. And if you compare the number to the ratio of the population, it's quite a lot. So this situation, additionally to the life, that it's pressure and it may cost life, create overload on the system and puts the health system in a very fragile situation. The Israeli state started by December 10 the operation of what we call a lend a hand, or as we call it in Israel, lend a shoulder, that have the same meaning of lend a hand in English, but it's also emphasis the body area for the injection. A national committee has decided the criteria and priority for vaccination. Based on the accumulated data, criteria have been updated in ongoing process. The principal guidelines for priorities are all to ensure the vaccination's safety, efficiency, and effectiveness. The priority was for medical personnel, paramedic, physician, nurses, and other health professions team and student. All of them in general hospital, geriatric hospital, psychiatric hospital, health maintenance organization, other health facility, and other institution related to health services, and private clinic. The priorities also included all population above 60 years old and focus on the high-risk population, including people suffering from diabetes mellitus, hypertension, obesity, immune suppression, hematological patient, and people with low pulmonary function. And then, of course, it's included also all elderly residents in nursing home facilities and their caregiver. As of the 9th of February, yesterday, about 5.7 million Israeli citizens have been vaccinated. That are 33% of our population. About 3.5 million people have been vaccinated with the first dose of vaccine. That are 39% of the population. And about 2.2 million people have been vaccinated with the second dose of the vaccine, which is the 24% of our population. The idea is that we want to have at least 80% of our population, mostly those who are in high risk, vaccinated in order to gain herd vaccination. Although at the beginning of the operation, it was characterized by high public cooperation and response, we face an increasing number of patients, probably due to the character of recent COVID-19 variants. Furthermore, the character of the recent outbreak is marked by presenting an increase in critical patient and patient from younger age cohort than seen in preceding months. As of yesterday, residents without legal status, those who don't have national health insurance in Israel and who are not covered by the Health Maintenance Organization, entitled also to have free vaccination by the state. As of 9 of February, yesterday, about 80% of the high-risk populations have been vaccinated with the first and second dose. So you can see everyone's at beyond 60 years mark over here. And although the majority of them vaccinated with the first dose, we already have quite a good number of people who are vaccinated with the second dose. And we believe that this might help to contain the outbreak. Yet, following the data we mentioned above on the increased number of patients, at the end of January, vaccination priority have been updated. Population above 33 years old, pregnant women from the second trimester, teachers, and high school students from 16 years old and above are entitled to be vaccinated. And furthermore, at the beginning of February, all population above 16 years old was encouraged to be vaccinated, again, in order to get herd vaccination. As the operation continued, we found that some of the public resistant to the vaccine to be vaccinated, mostly because of rumors about the safety of the vaccines as well as side effects. So here is some data related to the side effects that we gathered together. And the side effects are classified out of 1.7 million vaccinated people according to their age. And as I mentioned before, we went further than this, and we have much more people that are vaccinated today. But related to this kind of information that we have, we know that, for example, out of 1,097 complaints, most of the complaints are related to general side effects that are 500 people out of the complaining people, and 376 complaints related to the local side effects. So what are the side effects that they complained about? If we are talking about the local side effect, 381 complaints, most of them related to pain. So you can see it over here, this one. And 71 people complained about swelling, and 30 and about pain and movement restricting. So basically, those complaints were usually related to day or two after the injection provided. When we're talking about general effects, of 475 complaints, mostly related to subcutaneous nodules. So you can see over here, oh, sorry, doesn't show. And the other major complaint related to headaches and dizziness. Rest of the complaint were mostly to some kind of feeling look like flu And many of the people say that it was for about few days after the injection. Neurological side effects. Of 92 complaints, most of them were related to paresthesia, and the other were not really serious, except one, a few that related to convulsion, and this was related to people who suffered from other disease also. Allergic reaction, which is the most terrified in a way for the lay public. As you can see, 76 complaints are mostly unspecified. So it might be that people identify any other side effects that they could not define them as allergic reaction, which can be assured that it is, and some related to scratching and urticaria. So what do we do and how we did it? The land of shoulder operation cooperatively between the Ministry of Health that determines the policy based on the vaccination committee recommendation and have the overall responsibility of all operation through the main command and control center. It's also related to the sub-center dedicated to specific domain included hospitals and nursing home that provided vaccination to their medical personnel, and follow that, reach out to the chronic patient admitted to the geriatric and mental hospital. And this is the time to mention that you know that hospital team, physician, nurses, and other medical personnel are part of the lay public, and their opinion is like the lay public. So what we try to do, we try to achieve at least 80% of our hospital staff to be vaccinated. And as we started this operation, they were the first priority, as I mentioned before. And until now, most of our hospitals have about 70 to 80% vaccination of the personnel from the first dose of vaccine, and about 60 to 70% of the second dose of vaccine. We are not satisfied with this, and we are trying to push harder to encourage them to be vaccinated, to at least go over 80% of vaccine to all our personnel in all hospitals, including, of course, the second dose of the vaccine. Additionally to the hospitals and nursing, there are another centers that manage the event. We are talking about the health maintenance organization that provide vaccination in hundreds of hubs spread all over the country by the nurses and additional team who are going to help them, and I will talk about them in a minute. And we have Magen David Adom, MDA, the Israeli Emergency Medical Service, our EMS, which is a national EMS. MDA paramedics are the first responders to all emergencies in the country. With the COVID-19 outbreak, MDA took upon itself a major role as COVID-19 test sample taking in special hubs and patient residence and institutions. And since we started the land of shoulder operation, they become part of the team that administrate vaccination in community sites, nursing home, and other community facility serves the elderly and special needed population, like vulnerable population. The Home Front Command of the Israeli Defense Force, under the umbrella of the Medical Corps of the Home Front Command of the Israeli Defense Force, supported the COVID-19 department in the hospitals and in the vaccination side by professional team, nurses, physicians, paramedics, as well as trained soldiers that are taking part in the epidemiological inquiry team. Major issue related to logistic, of course, and the Logistic Command and Control Center is responsible for all distribution of the vaccination. The complicated operation also include logistic, as I said, and it's related to the arrival of the vaccination to Israel, and of course transferring them from the airport to the logistic site. But before this, to store them in appropriate condition, and of course to distribute them. And what you see here is that we have only one deep freezing storage for the whole state. It can be operated like this because Israel is a relatively small country. And of course, it allows us to control what we call the farm of the storage, of the injections and of the vaccination, and to assure that it keeps the standard according to the requirement by the factory. So there is only one farm that keeps the vaccination and only one distributor of the vaccination to the different site, one company who keeps the same requirement, track standard, as well as the transportation. What are our challenges? First of all, staff. We have to remember that due to the amount of quarantine and infectious staff, and you can see it over here, the numbers of professional and medical teams that are in quarantine, some of them due to sickness, but most of them due to contact with patients. As you can see, it's necessary to ensure and to secure the staff. We need to do it by providing them personal protecting equipment, safe work environment, and of course, it's related also to refreshment, rest, and of course, emotional support to keep them resilient, to keep team resilience and avoid burnout. We have to remember that during the last year, our team working with shortage of personnel in very difficult environment and need to wear protecting equipment while they are working, and it's the toll of being there is quite a lot. It's also included the support by emotional support by social psychology team, and of course we have to remember that each one of these team members have family behind that they have to take care of them, and we provide also support to the families, either emotional or in case of quarantine, some physical support if needed, and anything that related to the family function. Also, we have to remember the workforce reinforcement and train for this specific operation. To overcome the shortage of qualified personnel, the nursing division at the Ministry of Health decided to temporarily allow medical and nursing students to become part of the staff at the vaccination site. The Ministry of Health also allow emergency medical team of emergency services to administer the vaccination. Yet, all of them need to be trained and qualified before starting the work in the vaccination site. As mentioned before, the training program was established by the nursing division at the Ministry of Health. Training includes theoretical study related to COVID-19 steps and action in administrating the vaccine, side effect, and treatment approach to anaphylaxis, reporting, and registration in the local and national system. Following the theoretical study, the practical experience including orientation to the site, the operation procedures, and information system, and only then the student could work on site under supervision of registered nurse. Everything that related to logistics created, of course, huge challenge because this is something that we never did before. We never vaccinated a huge amount of population within very short time, and it's created additionally to the vaccination farm that keep the vaccine under certain condition. also to consider the mobilization of it, and of course, to keep it up in appropriate condition. So as I mentioned before, there is only one deep freeze storage, because we use mostly the Pfizer vaccines that require -70 Celsius degree. And one supplier distributes the vaccination to the different site controlled by the logistics center. It's hard to keep and control standard of storage and administration, as well as distribution, of course, but in the same time, it may create some limited in case of fault. Due to the short duration of the vaccine expire date, this is a need to be administered in very tight schedule that require pre-registration, site organization, manpower enforcement, and of course, out-of-the-box thinking in case of problem. For example, what would happen in case of no appearance? What would happen if a person will register to come, but will not be at the point of the vaccination, and we need to use the vaccine very quickly? In order to don't miss and don't lose vaccines, most of the time and these days, the health maintenance organization allow at the end of the vaccination day to people who didn't register to come and to be vaccinated, because we don't want to throw away vaccines that might be expired. So it's also related to some communication problem. Because we have only one distributor, the only way to connect with him is through the command and control center, because try to imagine what would happen if every endpoint will try to connect just to see what will be the time that the vaccine will arrive to the point. So in one way, it's good. On the other hand, it creates some kind of gap between communication, and everyone needs to be communicated to the central command area, but not to the distributors. Major challenge related to our public. First of all, we need to secure public on vaccination site. And I'm talking mostly about social distance. It's also related to cultural aspect and the way Israelis socialized. Israelis are very warm people. They like to be close to each other. They don't keep social distance. They don't avoid touching each other. And of course, when you come to be vaccinated and you have a lot of people there, it might be the contaminated area instead of the vaccinated area. So this is related to the way we transfer the information to the people and trying to keep order on the site. And you can see over here in these two pictures that these are some of the sites that open specifically for this. Most of the people do keep social distance, but we face many times the problem of it. The use of social media also is very popular in Israel and increased fake news as well as risk communication. Both increased the government loss of public trust. It's mostly because of misinformation that published by social media through the Facebook, WhatsApp, and based on rumors and personal opinion, on other hand, updated information published by the authority may increase disinformation. Mostly because it's changed often since it's a new so-called disease and the information might be changed or updated. In order to avoid misunderstanding, there is a need to be attentive to cultural diversity and to gain public trust, and to apply to each one of the community with the same ways that will work for them. For example, the ultra-Orthodox community listening to the rabbi, but they will not listening to the government officer. And we need to work through the leaders in the specific community. So it's important to focus on information that will fit to each one of the community and to study about the community diversities in order to gain the public trust. And then we need to encourage the public who have not yet been vaccinated to get the vaccinated, because this is the only way we will have a hard vaccination. So, if we're going to summarize the challenges that we're facing and the situations that we have in Israel, performing mass vaccination is a major challenge to the person, professionals, team, but as well as to the society themselves and to the public. There is a need to increase public awareness and cooperation, focus on each one of the community, specialized, characterized. There is a need also to enforce regulation. At the same time, to be sensitive and to understand cultural differences. One of the major problems that we face is that we don't really enforce the regulation. So even though the government decide that there is a lockdown, people allow themselves to go out during the lockdown, and they are not enforced to do it, and they can allow themselves to do bypass to the government order in a way. This is something that again reflects the untrust of the government, of the people of the government. And on the other hand, they know that they can do whatever they want, those who break the law, because nobody really enforces it on them. There is a need to increase the public awareness and cooperation, like I said, by forcing them to follow the regulation and to understand the advantage of being vaccinated and keeping someone else's order and keeping the other people alive. And of course, according to the manufacturer and the Ministry of Health report, as we follow the side effect of the injection, we see that the side effects here are not changed from any other vaccinations that provide regularly on a regular basis. So this is something that we should explain to the public for those who are afraid of the side effect, who are not sure that the vaccines are secure. It is our responsibility to provide them the knowledge, to provide them the information, to feel comfortable with this, and to come and be vaccinated. And at the end of it, I think that one of the most important things for us as medical personnel is to understand that there is mutual responsibility. We as medical staff have responsibility for our patient, our community, and of course ourselves. But the mutual responsibility related also to the public itself. And I think that if we learn how to look at each other and to say, even if I don't concern about myself, even if I don't believe that I'm going to be sick, even if I don't believe that this is a huge, awful disease, I need to take care of my dearest, of my family, my friend, my neighbors, and everyone else. And I think that the efforts that the medical team doing in every level is huge during this year. And I would like to thank to the team of the General Medicine Division, the Medical Directorate at the Israeli Ministry of Health, that I'm part of them during the last few months. And they are led by Dr. Sigal, who helped me to present this, to prepare this presentation. And of course, they are doing devoted work, and I do hope that we're going to have the power to continue it until we contain the disease. Thank you.
Thank you, Odetta, for the presentation. That was very informative. We're now at the stage of the webinar where we can take questions from the audience participants. I have a few that have come in through the question panel. If anyone would like to raise their hand virtually, we're able to unmute your microphone and you could ask the question directly to Odetta. The first question we have from Patricia Frost. Patricia asks if there's any anti-vaccine movement in Israel, and if so, how have you addressed that during the pandemic?
Sorry, I didn't hear. Is there any what? Andrew, can you repeat?
Sure. Is there an anti-vaccination movement in Israel? People who don't believe in vaccines, sometimes called anti-vaxxers.
Yeah. Yes, unfortunately we do, but this is normal because look, in normal days, even not about during the time of the outbreak, you have people who against vaccine, and we cannot force them. This is a privilege. This is not something that we force. And there is no laws that can force people to be vaccinated. So yes, there is a movement like this, and this is work mostly through social media and a lot of rumors. And we try to convince them, and we have a huge work on explanation and public and provide the right information in order to reduce it. But you cannot stop it. It's there. And we cannot force them to be vaccinated.
Great, thank you for answering that. I guess this question is somewhat similar to that, maybe not anti-vax per se, but there is a question from John Fogel asking about how the government or the Ministry of Health is convincing ultra-Orthodox population to get vaccinated.
This is a huge challenge. There are a few things about it. First of all, we have to remember that ultra-Orthodox community they are the majority, the highest number of, let's say it like this, the highest number of infected population is among the ultra-Orthodox community, mostly because they are living in a very tight situation. They are living in very compound places, and they have a lot of families member. And during the outbreak of the new variant, the United Kingdom variant, that is mostly impact young people, we can see it increase among the ultra-Orthodox population because they have a lot of young children. So many of them got sick, and then they are not vaccinated really, because they are not in the criteria to be vaccinated right now. Right now, every recovered person is not vaccinated. And those who are not vaccinated, we encourage them to come, and so those who are not sick or not recovered from sickness, we encourage them through the rabbi, through the community services that they have, and by the community leaders, because most of the times they will not listen to those who are not from the community. And still we face some problems because some of the leaders, their most radical leaders, they don't come against vaccination, but they come, for example, against the lockdowns that we have. And if there is no lockdown and you don't keep social distance, you increase the sickness. So we try to encourage them through their leaders. And some of the places we do have the cooperation, some other places it's more difficult.
All right, so we have a member of the remote audience who'd like to ask a question directly. I just sent him a message, so hopefully he got it. Theo, I'm going to unmute your microphone and you can ask a question directly to Odetta. Are you there, Theo?
Yes, thank you. Hi, Odetta. Thank you very much. Theo Lichtelm, South Africa. We checked your testing process and you were using a lot of drive-through actions in your testing approach. Did you use a similar approach for the vaccination with drive-through facilities, or were all your vaccination walk-in facilities? Over.
Well, just let me be clear. I'm not sure I understand, but let me repeat it. Have you asked about do we provide vaccination at home or only in the walking places that the public will come there. This is what you mean?
No, what I mean is, did you allow people to drive in with their cars and
Yeah.
be vaccinated in their cars, or did you only accept them in a walk-in facility? Over.
Okay, I didn't hear you at the beginning. Okay, the testing, let me start from the test site. The test to COVID-19, this was, part of it was in car, going with the car to the site and taking the test. Some of them are walking in. When it's come to vaccination, it's only walking in. So we open some of the walking in area in the health maintenance organization facilities, some of them in huge stadium, and some of them in the city circles area that we organize places there. But it's only walking in area.
Thanks for that, Odetta. Thank you, Theo, for asking a question verbally. We have another question that came in during the presentation asking if you could comment on vaccine distribution in the West Bank and Gaza Strip.
Of course. I think that Israel already, if I'm not sure, already started to distribute vaccination to Gaza Strip. We started, of course, with our population, because Israel, the state, bought the vaccination to our population. But we are very much aware to the situation because we don't have closed border. Also, we have lockdown, some of the borders open, and of course, people can come from one place to another. And it's important to provide Gaza in the occupied territory vaccination. So we already started to transfer them vaccination because the amount of patients over there is also increased during the last months.
Thank you. And we have another question that is from same gentleman, John Fogel. Thank you, John, for asking so many questions. And he asked, are there lessons learned that could be applied to a bigger country like the United States, for example? Israel is kind of unique in that it's relatively small population, under 10 million. It's not a particularly large geographic area. And then from the presentation, you mentioned the 4 health maintenance organizations. So, and then the cooperation of the National EMS Service and the Israeli Defense Forces. Something like that could probably be pretty difficult to replicate in a country the size of the United States. But we're wondering if you could just comment on that.
I think that it's very difficult to duplicate it to the state because, again, it's a huge, huge, huge country. It's countries, it's not country. But I think that one of our major lessons learned that can be universal in a way is the public information, dismiss the information, to provide the right and the accurate information to the public. Because we realized at the beginning there was really a lot of interest by the public, and they cooperated and they rushed to be vaccinated. And with the rumors that appear, with those people who are against the vaccinations, and those who use the social media with their fears and with an incorrect information, we lost some of the public. And I believe that if you provide the accurate information, if you think about it in advance and you take into consideration all kinds of communities that you have and refer the information specific to specific community by specific way, you may avoid a lot of mistaking. You may increase more people to come to be vaccinated. And I think that this is universal. It's not related to Israel. It's not related to any other country. You just have to identify what's unique to your community, how to apply to them. But if you will learn about our experience, about the ways that we provide the information, it may help in other countries also.
Yeah, I think the public health messaging is universally important, and tailoring the message to different communities within countries I had a question for you. We're out of questions from the remote audience, but I had one question. Earlier in the presentation, you mentioned that the goal was to vaccinate 80% of hospital staff. Was that inclusive of staff or personnel such as the administrative staff, cleaning staff, or was it only exclusive to the frontline health workers, doctors, nurses, technicians, etc.?
It started with the front line, but it's cover everyone from the hospital worker. So the idea is, yes, first of all, of course, to protect those who take care of the patient. But they are not separate from other people because they are there. And the other staff, like administrator, like cleaners, like whatever, you name it, are there. So basically, it's open to every hospital staff member, not only clinicians.
Great. Well, we are out of questions from the remote audience, and we have one comment here that I think kind of wraps everything up. And Norm Ruker from the audience says, "Thank you for an excellent presentation." And I personally would like to thank you as well, Odetta. I think that's a great way to wrap things up here. Thank you everyone in the audience for participating. As Sarah mentioned at the beginning, we'll send out a link to the recording of this and the slide deck, and we'll also encourage everyone to have a look at the WADM podcast series on our SoundCloud and YouTube pages, and I'll include some information in the email we'll send out about that as well. Thank you again, Odetta. We really appreciate you doing these webinars for us. I think this is either your third or fourth, so you're kind of one of the all-stars of the webinar series for WADM.
Thank you, Andrew, and thank everyone that joined us. And please keep safe, and hopefully we'll have the chance to have some meeting instead of webinars, with many webinars also, but also meeting. Thank you very much.
Thank you,
Andrew and Sarah, for everything.
Bye, everybody.
Bye.